Welcome to Leadership Chats with Dr. Wise, the Not a Lecture podcast where we explore what it really means to lead in today's complex healthcare environment. I'm Dr. Wise, and in this series, we're having real conversations about essential leadership concepts. We'll talk about what you need to know, what you want to know, and what you'll actually use in practice. And yes, what you need to know to pass the exam. Each episode, I'll be joined by a guest expert who brings real-world experience and insight into nursing leadership, from managing care teams to fostering a culture of safety and everything in between. Whether you're listening on the go or settling in with your notes, this is your chance to deepen your understanding and connect what you're learning to real-world practice. No slides, no lectures, just meaningful conversations that bring leadership to life. Welcome to Leadership Chats with Dr. Wise. Today, we're diving into one of the most essential skills for every nurse, and that's putting evidence-based practice actually into action. So I'm joined today by Dr. Karrie Boss. She's an expert in evidence-based practice and nursing scholarship. Dr. Boss is the System Director for Evidence-Based Practice at Summa Health in Akron, Ohio. She has extensive experience in guiding nurses in how to ask the right clinical questions, evaluate research, and translate evidence into safe and effective patient care. As you're preparing to step into practice after graduation and maybe even thinking about your role as a nurse leader down the road, this episode will help you connect classroom lessons about evidence-based practice to the realities of clinical decision-making and practice change. So let's start chatting. Welcome, Dr. Boss. It's good to have you here in this conversation today. So why don't we start off by having you share a little bit more about yourself and your background?
Sure. Thank you, Tiffany, Dr. Wise, for welcoming me today. So I have been a nurse for 24 years, going on 25 years, and primarily worked my entire career in critical care, and went back to school after about 15 years at the bedside in an ICU setting. I worked trauma ICU for a long time. Kind of hit a point in my career where I was ready for a different type of challenge. And I was starting to see things at the bedside. I was always intrigued by how things were performed or the way that we provided care. And so I really started looking at an advanced practice role. And the one role that stood out to me was the role of the clinical nurse specialist. And as one of the 4 advanced practice registered nurse positions, this position was very interesting to me because it kind of blended evidence-based practice. How can you support the nurse at the bedside? How can you support the patient in ensuring that the best care is being provided? And then how do you support and optimize things across the system? And so I really, thought that was an interesting role. I had a lot of mentors in my career who were clinical nurse specialists. And so I did become a clinical nurse specialist and then worked in an ICU, also covered an ED during that time, and a stroke population as well. And now I've been in a leadership position in this particular position for the last 3 years, really leading evidence-based practice across the entire health system. So not just within the hospitals proper, but even across our ambulatory settings, our surgical centers, to ensure that we have a space where nurses are encouraged to actively ask questions and then to be able to get the best evidence to the patient quickly. And so that is really kind of my role in a nutshell. And I love what I do. So I love being a registered nurse. I love being an advanced practice nurse and now a nursing leader because I can influence the care that's being provided, and be able to support our nurses at the front lines.
That's awesome. And I think it's really neat that we have your perspective as a clinical nurse specialist. I feel like, just from my experience, and I'm not giving this from a data standpoint, but from my experience and practice here in the state of Texas, we do not utilize clinical nurse specialists to the extent that they are used in other regions across the nation. And so it's really neat to have that insight and perspective because that's something that we don't see in practice very much here. Yeah, exactly. I think there's probably some very useful opportunities, especially when you're talking about roles like you have, like evidence-based practice, quality improvement. I think the type of education and training that you get really lends itself well to bringing that expertise into these specialty areas of nursing and nursing leadership.
Absolutely.
Yeah.
Yeah.
So
Great.
awesome. Well, let's get started our conversation. I mean, so a little, our students have already taken a whole entire course over evidence-based practice. So we really don't need to focus so much on the details of what it is or the how.
Yeah.
We'll probably touch on a couple topics just to refresh some things. But really what we want to gain from you is a conversation about what it looks like in action and really making it practical from the first time they step on the floor as a new nurse and what evidence-based practice really looks like outside of a formal course that they take in their program. So, so from your perspective, to start us off, how should nurses think about evidence-based practice as more than just a process and what it really means in practice?
Yeah, that is such an important question because oftentimes, we learn about the steps of EBP in our course, and then we don't really get how that works then when we become nurses. We become very consumed in our everyday tasks. And sometimes we think about EBP as like a research project, and it's very different. And we learn about it in school as this very like linear process. It's a very systematic approach. We have a clinical question, we form a PICO question, we search the literature, we appraise the literature, we synthesize it. So those are very sequential, systematic processes. But in reality, it's so much more than just those steps. And for me, I would say evidence-based practice is really a professional mindset. And that's what I think nurses really need to take away from those courses. It's about being curious, asking questions. Why are we doing it this way? Is there a better way to perform this task? And then really holding ourselves accountable to that knowledge that we have, and saying we're not doing this just based on tradition or the way that we've always done it. And I think
Mm-hmm.
sometimes we get into the habit of doing that. So
Mm-hmm.
it's blending the three essential components of evidence-based practice. What does the literature say we should be doing? What is our own clinician expertise? And then what does the patient want? What are their values and preferences? And then combining all those, that's the science of evidence-based practice. So in practice, and this is something we really work to develop at Summa Health, it's a culture where nurses don't just follow protocols blindly, that they ask questions.
Mm-hmm.
They feel that they can, ask the question, they can innovate, they can be a part of practice change, and then translating what that evidence says into really the real world, practice changes. So, because we know there's better ways, like there's
Mm-hmm.
better ways to do things. And sometimes the evidence isn't clear. And so, is there an opportunity to do more research, or can we innovate beyond even what the research says? And so that's where we need that mindset, that culture of that registered nurse to really be thinking about, is there a better way? And why am I doing it this way?
Right. And I think too, as you're describing that, it applies to nurses across all levels of nursing. But I think some of the best individuals who are primed for that type of mindset are new nurses because
Yeah.
they've just finished school where you've learned every standard, at its most correct way to do it, I guess, if we want to call it that.
Yeah,
And then you go into practice and you see things done a variety of ways, and some
absolutely.
or maybe you learn that standard and you're like, why am I doing it this way? So I would argue that new nurses are some of the best, bring in some of the best perspective in asking these questions just based on their fresh perspective that they have. So you mentioned about the three pillars of evidence-based practice, being the evidence, the expertise, and then the patient preferences as well, because ultimately we always want to think about the stakeholders and the end users and what we're doing. So, can you give an example of how those might come together at the bedside, maybe in an experience you've had, or just a clinical example that you feel like is relevant?
Oh yeah, I think, you think about the normal everyday of a registered nurse, and oftentimes that registered nurse needs to place an IV. This is like a very basic, but I think it's a relevant example. So, you know, that nurse uses the latest evidence, the best practices for, and the guidelines for how they should start that IV.
Mm-hmm.
but then relying on their expertise to go, which arm should I use? Which vessel is the right vessel? And then incorporating that patient's preferences and values into that, making sure that they understand the
Mm-hmm.
why behind getting an IV. Maybe they understand, I'm a difficult stick, my right arm, and you need to, use my left arm. And so having those conversations with the patient and including them in that, I think is one example of really combining, what does the literature say with my own expertise and then the patient's preferences and values. Another example I think that nurses can relate to is using like nurse-driven protocols. There's a lot of nurse-driven protocols out there in practice. One example would be, urinary catheters. And so the evidence tells us the longer we have, a urinary catheter in, the higher the risk for our patient, the higher the risk for infection. So a protocol would empower nurses to assess whether that catheter is needed, to remove it if it's not needed, and then once that criteria is met, that nurse can go ahead and remove it without a physician order. So I think then being able to communicate that with the patient to say, you no longer meet criteria for the catheter, but maybe they're like, but I really want the catheter.
Mm-hmm.
How do you have those conversations, with the patient? So it's about kind of blending all of those to drive better patient care and professional growth and then patient outcomes ultimately.
Those are great examples, and I appreciate how they apply all three of those pillars of EBP. So, for many students, the big question excuse me, the big question might be, what does this evidence-based practice look like in day-to-day nursing? So, you talked about the IV, the IV situation and how that it brings in, or the nursing indicators that allow for you, to make decisions, which I think is a great example of how two nurses are using their full scope in our clinical judgment that we're developing. So, how would you say that, in a just day to day routine care, how do you see evidence based practice showing up? I mean, I think of the standpoint of obviously we're using it in what the care that we're providing. But what, you could expound on that some, but what other ways do you see that it kind of spreads throughout all that we do in routine care?
Oh yeah, I don't think nurses always recognize that they are, that they're evidence in their practice. In fact, when I meet with new nurses, I'll sometimes ask them, who here feels that they are evidence-based nurses?
Mm-hmm.
And it's shocking to me the number of hands that don't go up.
Mm-hmm.
And then I provide examples like I've provided and one I'll provide now that they are being evidenced in their practice, but because maybe they don't feel like they're experts in evidence-based practice, that they don't always recognize that they're blending it in. So one example is, imagine a patient recovering from surgery, and this patient is in a lot of pain. And so the evidence, the literature supports that a multimodal approach, so using both pain medication and maybe some non-pharmacological interventions like, guided imagery, we learn about that in school, or um, warmth or cold compresses may help with that. That can reduce their pain and maybe speed their recovery. Now, when the nurse's expertise comes in, they recognize that, the patient not only is in pain, but they're also anxious.
Mm-hmm.
And so maybe relaxation techniques to help with their anxiety would be best. And then in talking to the patient, where you're like, having these conversations, you're in pain, you're anxious, what has worked for you before? And the patient says, you know, relaxation techniques help me when I'm feeling anxious, and I'd rather not take an opioid right off the bat. Like I don't
Mm-hmm.
feel good when I take them. So that's like one example where you have included, your expertise, the patient, and what the evidence says we should be doing in your everyday practice. So when all three of those come together, you know it really is the art and the science behind nursing.
Mm-hmm.
And what we should strive for every day is to be evidence in our practice. So I think like picking up on those little scenarios and asking those questions and having conversations with our patients, like what works for you, what doesn't work for you, what do you see what do you want to happen while you're here in the hospital? And that all of that is being evidenced in our practice.
Yeah, that's great. And I think we've come to a point really in the way that we practice nursing care or medical care. I mean, really, I think it applies across the board and professionally that almost everything that we are doing is decisions are driven by evidence and
Mhm.
the approaches to care that we know have been proven to be the most safe and successful, almost to the point where sometimes I feel like maybe we lean so heavily into protocols and evidence to make decisions. And that's where we talk about the art of nursing or the art of medicine is being able to take that evidence, take the patient, and make decisions on how we provide care and how we're going to best care for patients based on a combination of all those things together. Because it's not really one or the other. And sometimes I think that there's some caution against leaning only into evidence and not thinking about the other aspects as well. So, um,
Absolutely.
yeah, those are great examples. So sometimes the best evidence-based projects, and when we get back to thinking of that practicality, a lot of times we just go straight to that project mindset. But when we think about those projects, those come from simple observations like, why do we always do it this way? Or, does this doesn't make any sense? Or I'm not getting the right outcome from every time I do this. So how can new nurses translate those observations into opportunities for change?
Yeah, and I think that's really kind of, reaching out to the resources that you have, in your organization. And, hopefully you're in an organization where they have structures in place that support the nurse, asking questions, whether that's through an RN educator or a clinical nurse specialist or, just your management and staff supervisors, charge nurses, those are all resources. And so being able to not be afraid to ask questions, understanding who you should ask those questions to, and then how do you get an answer to those questions. So whether that's looking at your current policies or your procedures, or maybe it's reading a guideline to inform you. But I think many organizations have those resources. It's just a matter of nurses being able to tap into those resources and understand what that process may look like for them doing evidence-based practice or getting a question answered that they have about the way they provide care for a patient.
Yeah, those are good examples. And I think too, I would say many hospitals, and I think of many of our major hospital organizations here in the state of Texas, but across the nation, have shared governance structures in place. And a part of that shared governance, especially if they're like a magnet facility or striving to be magnet, even those that are pathways to excellence, they have structures in place where they have specific councils that
Mm-hmm.
focus on evidence-based practice. And I think it's very important to encourage students, especially if this is something that intrigues you, or if you find yourself often asking questions of why, or you want to do your part to understand why and maybe influence change, that participation in those councils is extremely valuable. And then you get to take part in actually making these decisions and setting the standards and the precedents for how care is going to be provided across the organization. So
Yeah, absolutely.
um, all right. So, thinking about this, can you share a story from your own career about when evidence-based nursing changed, or evidence-based practice changed and improved outcomes for patients or for staff?
Yeah, when thinking about this question, I go back to my time as a clinical nurse specialist when I led a stroke center. And that, initially was very new for me. I had gone from a bedside nurse now into a clinical leadership position, was responsible for the critical care, the emergency department, and the stroke program. And so in my initial observations and looking at the data, our door to needle times for our stroke patients were a little longer than what was recommended. And so one of the things I did was, looking at the evidence, what was that? What is the best practice for our stroke patients? And so one of the things that came out in that literature was telestroke. And we found that in that organization specifically, the time from the patient arrival to the time they saw a neurologist was a little long. And neurology was the one who would say, yes, we believe this patient's having a stroke, and they may or may not be a candidate for that clot busting drug. And so that decision point took too long, which then extended the time it took for us to give the medication. And so by implementing telestroke, it allowed our nurses to really engage in a video consult with a neurologist almost immediately when that patient arrived. And then using that technology, they were able to initiate that thrombolytic therapy much faster, which ultimately reduced the complications for the patient, improved their outcomes long term, and then even improved like how quickly they recovered. So
Mm-hmm.
it wasn't just about implementing a technology, it was about applying what the evidence said for rapid evaluation, to improve outcomes, and then trusting that nursing expertise to how do we then like connect the pieces and make this part of our workflow, and then include the patient and the family, most importantly, too, throughout the process. So that initiative really was kind of my first big eye-opening experience to the benefit behind evidence-based practice and
Mm-hmm.
really seeing that process all the way through. So,
That's a great example. And as you're telling that example too, I think about how it ultimately and most importantly improved patient outcomes because for anybody who's been involved in caring for somebody who's experienced a stroke, I mean, that can be absolutely life altering with really detrimental consequences. So to prevent that from happening is amazing for the patient and for their family members, their caregivers. But I can see where it also has improved staff aspects to it too, because
absolutely.
it improved their workflow and it made their work more efficient. It allowed for everybody to work together more effectively, which not only feels good, but it just helps the workflow to be much better. So that's a fantastic example.
Yeah, and like to your point too, I mean, beyond even the efficiency of it, just some of the frustrations the nurses felt in those, emergent situations, maybe was lack of communication and, conversations happening over the phone versus, in-person
Mhm.
consultation. And so even though it was this virtual aspect, which was new for them, it was still considered a face-to-face. And that neurologist laying eyes on that patient, but the nurse also being kind of the go between the eyes and the ears through that assessment. And so I think, to your point, from a satisfaction perspective, they felt engaged through the whole process, and they felt like communication was not only expedited, but it was like closed loop communication in
Mm-hmm.
its most perfect form, right?
Right.
Because you could see that process through for the patient. So it was a great satisfier for the staff as well.
That's awesome. Great example. I appreciate that. So let's kind of switch back a little bit to getting involved with EBP. So, I think students wonder or may think about EBP is just for those people that sit in the offices, or it's for the researchers, or some specific role. So, I know we touched on this a little bit, but from your perspective, what are some practical ways that brand new nurses can participate in EBP in their first nursing role?
Yeah, I think even for me, I think back to when I was in school, undergrad, and taking it was an EBP. It was actually a research course. I don't even think the word evidence-based practice at the time was
Mm-hmm.
in the course, although we learned about evidence-based practice, but it was a lot of research discussion. And I left that course a little intimidated, to be honest, at the bedside, and kind of like pushed it, like to your point, that's for the researchers. Other people do evidence-based practice, and it didn't really connect from learning it in the academic side to practice. And I think that's still true to some point today, because I hear that also from
Mm-hmm.
nurses. And so there's so many practical ways. I've given examples of where nurses are really evidence in their practice, but I think really going back to the nurse's responsibility is to ask questions. And so why, is there a better way to prevent catheter associated urinary tract infections? Why do we use this dressing for wounds? So collecting like those small observations in our everyday care, maybe we're noticing a trend in our unit. Our patients are falling more. And not only are they falling more, but they're having more significant injuries when they fall. And so, like, going, why are they falling more in our
Mm-hmm.
unit? And really being able to take that wonder, your observations, your questions, to your preceptor, to your manager, to your clinical educator, and saying, I have this curiosity. I want to provide the best care for my patient. And I notice in our unit, we have a lot of falls. And so taking that curiosity really sparks, that's the whole start of evidence-based practice. And then, taking it to those people that can say, yeah, that's a great question. What does our policy say how to prevent a fall? What does our procedure say? Are we providing the top things to prevent a fall? And so I think the key is to just start small, to be curious, to ask questions, to communicate those with somebody, whether, like I said, whether that's the nurse that's been on your unit a long time, you trust that nurse, maybe they were your preceptor, taking it to your manager, and then really, from there, having them guide you as to, now how do we put this into action? Is it going to be a practice change that comes out of this? Maybe it's a process change. um, but either way, I think that's really the key, is for nurses to go, it's not just an EBP initiative, it's just being curious. I'm starting with that. I'm asking questions and knowing who I can ask the questions to, and then how do I get those answers? That's really
That's
the
a
beginning of it.
That's awesome. That's a very practical and applicable to everybody. I don't think anybody can skip out on that one. So, like I mentioned before, many hospitals have shared governance councils, research committees, practice councils, and often intimidating, I think, to get plugged into those. I think some hospitals do a really good job in their residency programs of engaging students in those councils and actually requiring them to go through an evidence-based practice process, or more formal process and presentation. So how would you recommend, maybe you're in a hospital where, or students in a hospital where it's not, the process is not so laid out for them. How would you recommend a new graduate getting engaged and getting involved in some of those councils without it being too overwhelming or intimidating?
Yeah, it definitely can be, intimidating. I think as new nurses, you graduated from school, you're taking your state boards, now you're a licensed nurse, you go through your orientation, maybe your residency program, and you're just really trying to focus on, what does it look like for me as a registered nurse day to day?
Mm-hmm.
And I think sometimes they view the professional governance, the extra committees, maybe an EBP initiative as more.
Mm-hmm.
And really, ultimately, it is us as nurses. It's our responsibility as nurses to always be professional in our practice, to grow professionally, to advocate, to be a voice for nursing.
Mm-hmm.
And nobody owns nursing practice but nurses.
Right.
And so these are the platforms for nurses to voice their ideas, to
Mm-hmm.
voice their questions, to voice their concerns, their, and I think to start, the best way really is to start small. You don't have to chair the committee. You don't have to start right off the bat, like, let's do an EBP project, but just get involved. Maybe it's going to your unit council that month, talking with your manager, saying, I am interested in just attending the unit council, or I'm interested in attending the pharmacy council because I notice we have a lot of delays in our medications arriving to the floor. And I have some thoughts around that. So can I just attend, to learn, like, what this council is discussing, or, what their vision is. And so sometimes just starting small, getting an idea of what councils are available for nurses in the organization, and then, observing in them what's happening day to day. I think finding a mentor, hopefully your organization, right out of the bat as a new grad, maybe it's through residency, you identify with a mentor. That mentor can help guide you for some of those committees on what to join. A preceptor can help you with that as well. Like I said before, an educator or a CNS, those are always um, go-to resources for doing that. And then just approaching it like gradually, starting small. New nurses then can be more confident. They can build relationships, because that's the big piece of it too, is, you know, who are on these committees, who are these resources outside of nursing that you can then develop relationships with, and learning the rhythm of the organization, the rhythm behind professional governance and the work that they're doing. And then how, as you, even as a new nurse, how can you influence and make better the practices that are happening within your own individual unit? So
That's a
start
great,
small.
yeah, great recommendation. And I think I really like that, by starting small too, in starting small, sometimes it's just listening, right? Exposing
Oh, yeah.
yourself. And so,
Observing the conversations that happen. Like,
yeah.
what kind of questions are people asking in these committees, and what do the discussions look like? And sometimes just being an observer
Hmm.
and listening and learning, you learn how the dynamics occur between different departments or different divisions or professions. How does pharmacy collaborate with lab and lab with nursing? And so, outside of your normal everyday, just sitting on those committees can be very eye-opening for staff. And, some of our frontline that sit on those committees, wow, they bring such an insight that leaders don't always see,
Hmm.
right? Because we're in different positions. We're not always at the bedside. We're not necessarily working different shifts. So really, those nurses understand the gaps and what's occurring in practice. And so we need them. We need their voices at all of those tables.
Yeah, that's an absolute great recommendation. I appreciate that. So, from your experience, have you seen a novice nurse or a new grad who played a key role in sparking or supporting an evidence-based project that you might have either known about or participated in?
Oh yeah, I'm excited at SUMA. We relaunched. We had a shared governance structure for many years, and then moved away from that to professional governance, which is similar, but really trying to blend leadership, all levels of leadership, in with the frontline nurses. And so our nurses that are involved in their professional governance are involved in evidence-based practice all the time, because as staff ask questions, as physicians ask questions, before any practice change is made, we share that question and what we found in the evidence with our frontline. And we say, how do we make this happen? If, one example for that was pressure injuries. We were seeing a high number of pressure injuries in our organization. So we went and did an extensive, like 8 months worth of literature search and review. And we came up with the top 5 interventions to do to prevent pressure injury. And before we just went and implemented that, we brought it to the staff and we shared the problem with them. We shared the data with them. We shared the recommendation, and then we integrated their voice. And how do we do this now? How do we make this top 5 a reality in your unit? Because although the evidence said we need to do these 5 things, how we did them
Hmm.
in the unit may look different. And so we really have tried to, and I think we've been successful with integrating our frontline through professional governance with every initiative that we take on. So I think, encouraging them to, ask those questions, provide their input, um, sharing the data with them consistently and saying, okay, after we've implemented this, it's been a year, we're still seeing this problem, maybe drilling down into that a little bit further, and then using their insight to evaluate maybe their processes and workflows. And so I think that we've been successful with our professional governance in doing that.
That's great. And I'm sure that the outcomes of implementation are much stronger because you include those who are implementing it along the way. So I think it speaks to good, effective change process as well. So when we think about leading and sustaining change, evidence doesn't help patients unless it's actually implemented. And I think that's one of the challenges that historically, or even, I mean, even today, but we think about all kinds of research can be taking place, and there's all this evidence and bodies of research we have, but it's not really useful until it's connected to practice. And sometimes it can take a really long time for that to happen. So, from a leadership standpoint, what strategies help a team to successfully adopt a new evidence based practice? You kind of talked about this in your example, but can you break it down a little bit more for us and what you think are really effective strategies for implementing that evidence based practice or change?
Yeah, implementing is the hardest part. It's the hardest step in evidence-based practice. It's it it takes it's like EBP. EBP is very systematic. Implementation is also very systematic, and it requires a lot of preparation and planning and teamwork. And I would say, we're learning as we're implementing. We're learning what worked really well. We're learning what didn't work. We're trying to use implementation science strategies now to do this. And so I think one of the first things that we have really tried to focus on is engaging the team early.
Mm-hmm.
And so what that means is, sharing with them or having that front line ask the questions, sharing the data, engaging them early in here is the recommendation that's coming from the literature. Now, how do we put that into place? So, explaining why the change needs to happen, what the change is, involving the staff in how to make it successful. Like, how do we roll this out? How do we provide the education to the staff? How do we, what are the best ways to getting you to adopt the practice change? And I think by engaging them early, they're more likely to adopt it. And so that
Mm-hmm.
was really one of the first things that we worked on is engaging early. Second is providing clear guidance and support. This can include very, step-by-step protocols, education sessions. We've been very creative. We're evidence-based in how we provide education instead of just a health stream that needs completed. We do a series of education, multimodal education for the staff over a series of weeks. So before we implement a big initiative, we usually take anywhere between 4 and 6 weeks to educate on it. And that could look like, maybe an e-learning module, but also a hands-on piece.
Mm-hmm.
Maybe some interactive like QR codes. And we try to make it very interactive, very engaging, and where the staff kind of learn over time, over that 6 weeks of time. So that way they can absorb and be able to retain the information a little bit better
Mm-hmm.
and then be more confident in doing the thing that they're now required to do. And then I think the third piece in implementing really is the continuous monitoring, the giving feedback, and then celebrating success. And celebrating success, we don't always do very well, I think, in organizations. Even the littlest thing, like we had 100% of nurses assess their patient's fall risk this month. Let's celebrate it.
Mm-hmm.
Like just how are the staff doing those process outcomes that are leading up to the patient outcome? And so really recognizing them, getting feedback, what's working well, what isn't working, and like being able to pivot as you go along. So those are really, like, I would say, some of the three main things. And then the final one would be to, as a leader, we need to model
Mm-hmm.
all of the change ourselves. So seeing their own leaders embrace and prioritize evidence-based practice, it just reinforces and it builds that culture where evidence-based practice is not only expected, but it is believed that it's part of what they do as nurses.
Oh, that's great. And, I do agree and understand how the implementation aspect can be the most challenging, but it's also the most important to some extent because that's where we connect the evidence to the practice. And I think those are some great strategies. And I really like the celebrating part because it does make everybody feel, rewarded for the work that was done. And the success that comes with it, and that change, the change actually took place.
Well,
So,
nurses are competitive. We like to compete
yes,
with one another,
so
like
true.
we want to have the gold star in our unit every month.
Right, right. That's so true and very important. So once the changes have been made and you've been through that implementation process, you touched on the monitoring and evaluation. How do we know that it's working, and what outcomes are the most meaningful to measuring in real practice?
Yeah, we are doing much better about not just measuring the end practice outcome. For example, falls. We get that data to the nurses. What's the number of falls that they have had in their unit, every month, every quarter. What's the number of falls with injury? So that's like the end goal. We want to decrease, minimize. We want to have zero harm for our patients. We don't want any patients to fall.
Right.
And if they do fall, we don't want them to have injury, serious injury. So that's the ultimate end goal. But I think there's other measures that we need to be monitoring consistently throughout implementation. And that goes back to some of those process outcomes. So, if there are the top five things to prevent a pressure injury, we need to assess the risk, we need to turn and reposition, we need to put into place measurement for each of those things throughout the initiative and measure it at 30, 60, 90 days and then share it with the staff. And so that's what we really try to do is look at, what are the process measures we should be looking at and what do they mean for the staff? And then what is our patient outcome that we're measuring and what does that mean? And so making data accessible, making sure that the staff understand it. And one example of this is that, you know, the raw data we would share with the staff, and it was falls per 1,000 patient days. And it was very hard for nurses to really understand. And nurses were like, just tell me how many falls we're having.
Right.
So and like we heard them and like we're right, they're right. Like what makes sense to them? They don't want their patients to be harmed. They want to know that, excuse me, that the work they're doing is meaningful and it's impactful. So is the data meaningful to them? Do they understand the data? And so that's really the key to that is to make sure that they understand it, it's accessible and it's meaningful.
Yeah. And also that we're measuring the right thing too.
Yeah,
And
for
some of
sure.
that comes from setting it up correctly in the first place. But, we want to make sure we've clearly defined what the end goal is and what the outcomes are that need to be measured. I also think about, we can become too overwhelmed by the data too,
Yeah.
keeping it, like you said, to a few things that are most meaningful to actually measure what it is we're really trying to accomplish through the EBP process. So, do you have any example that you can share with us of how you measured the impact of a practice change and what was learned from those measurements or from that process?
Yeah, and I go back to that example with telestroke. Ultimately, we wanted to improve the door to needle time. That was our patient goal. We found that our door to needle time was too long, and time is brain. And so our
Mhm.
outcomes, just overall outcomes for our stroke patients, we were concerned about that. But like drilling down into why it took so long for us to give the clot busting medication was that the time for communication between the neurologist and the patient was too long.
Mhm.
So, really kind of digging down into that data. And after we rolled it out the telestroke, we continued to monitor those metrics. So the time the patient arrived, the time they got their CAT scan, to the time that they had the neurologist beam in on that monitor to evaluate them, to the time that we gave that thrombolytic medication. And then reviewing all of that, we learned that, these interventions significantly then decreased our overall door to needle times and then improved our patient outcomes. Our patients were going home sooner, um, required less rehabilitation, and so that was important to be able to share that with the staff, that they could see that entire process had an impact on the patient.
Mhm.
And so, being able to then like pivot where we needed to refine some of those processes, that all came from that continuous monitoring and evaluation of that data.
Yeah, great example. So when we look at, sometimes nurses might face barriers to EBP. Some of them could be time, resources, or even resistance from others. Hopefully, like you said, we're working in a culture that embraces EBP and it just makes it a foundational aspect of the way the practice works in that environment. But when we face those challenges, what strategies can be implemented early in nursing careers to help overcome those challenges?
Yeah, and I think that's ongoing. I mean, I think it goes back to sometimes the biggest barrier or challenge is just knowledge.
Mm-hmm.
Knowledge about evidence-based practice or knowledge about maybe an infrastructure that your organization has to support it, but also time. Time is
Mm-hmm.
also sometimes a limiting factor for the nurses. And so that's why I always say start small, just be curious, just
Mm-hmm.
ask questions. It's, I always tell new nurses, it's not the smartest nurse that's the best nurse. It's the nurse that never stops asking why.
Mm-hmm.
It's the nurse that always questions their practice, that is curious, that reads. Those become then the best nurses. So I think just partnering with, know who your resources are, have a mentor, reach out to your managers, reach out to your educators, your clinical nurse specialists. Maybe it's a nurse practitioner that you work with, and being able to, engage with them. Another strategy that we see we use is through our professional governance that we mentioned. So, like implementing micro changes, and sometimes it's just an update to a policy.
Mm-hmm.
Maybe we identify through a question that the staff had that we have the right practice, but the process is broken. The equipment is all the way down at the end of the unit. And so they're less likely to do the thing that they need to
Mm-hmm.
do because they don't have time to go all the way down to the end of the unit to get the equipment to do it. And so that's a great opportunity for, the nurses to go, let's think about how do we store our equipment, or can we put this piece of equipment in every room? Maybe it's a dressing that we utilize, to prevent a pressure injury. And so really thinking about it, asking those questions, thinking about it from a practice and a process perspective. And that doesn't really take time. That's sometimes a very
Mm-hmm.
quick fix, and it's a satisfier for staff.
Mm-hmm.
And they're more likely to do the thing that they need to do because their process now is more efficient. And so we're all about like, how do we make the processes that we do best and more efficient to then be able to provide better care for the patient.
Oh, that's good. So, I mean, I think sometimes the barriers to doing EBP really aren't as big as they seem like, because it
Yeah.
does not always have to be this big formal thing that we're doing or participating in, a council to this great extent or whatever. It can sometimes just be, like you said, observing and asking questions and recognizing where things can improve in your day to day process. So, part of our objectives is to understand the ethical conduct of scholarship, which is always kind of in the back of our mind when we're thinking about research, that we're doing it ethically and appropriately. So, what do you see as the nurse's responsibility when it comes to ensuring that EBP and research are conducted ethically?
Yeah, it's the ethical component. It's foundational to what we do as nurses, and it's foundational to evidence-based practice. And really, at its core, it means ensuring that we're protecting the patient's rights, their safety, their dignity, while using evidence to guide their care. That's what it is at the core.
Mm-hmm.
And so, nurses really must ensure that any evidence-based practice or research that they're taking part in, it follows ethical standards and ethical procedures. One example is like, does the patient, do they consent to the treatment that they're doing?
Right.
Are we maintaining confidentiality for our patients? Are we avoiding any conflicts of interest? So those are things that we also address and do in everyday practice, but we don't always relate it back to the ethics of our practice.
Mm-hmm.
And then I think as nurses, we're also responsible to critically evaluate the evidence and what we're doing. That's really a critical step in evidence based practice, and it should never be skipped or taken for granted. This step ensures that the research we rely on is valid,
Mm-hmm.
It's unbiased. It's conducted responsibly. And so if that research is going to guide what we do, we want to make sure that it's good research, right? And
Right.
so nurses need to advocate for, transparency in their practice, integrity of their practice, speaking up when something feels unsafe or unethical. And so it's really not separate from EBP. It's integrated into EBP. It's woven into the ethics are woven into everything that we
Mm-hmm.
do in our practice for our patients.
Yeah, very good. And it's a little bit different than the concept of, I think when we're talking about research specifically, there is a little bit of a differentiation between performing research and having individuals who are participating in that research, where you have a little bit of a different formality to the ethical side of that. And the implementation of evidence-based practice. There's a differentiation between the two, but
Absolutely.
how we're looking at the evidence and utilizing the evidence, and that, like you said, the ethics of it is woven throughout. It's a part of that process, and at the end of the day, really, we're always putting the patients first and their safety, and that is supported by that ethical perspective. So
Yeah, for sure.
um, okay, so to kind of wrap things up and bring it back to practice a little bit. So, as our students prepare to graduate, what would you tell them is the one thing that they can do right away to bring evidence-based practice to their daily practice? I mean, I know you talked about asking questions and participating in, listening and counsels and discussing with mentors. But what would you say is like the number one thing they should do right away?
That's it. Ask questions, be curious. I think that's the easiest thing. It's almost an obligation for us as nurses when we take those state boards, we become licensed professionals. We own our practice, and nurses own nurses practice. And so we have to be able to ask questions. If something doesn't seem right, speak up. Um, Being able to read the literature. I think every new nurse should read literature, become members of their professional organization, be able to look up guidelines, know what your guidelines are, what do your policies and procedures say. That should be everyday practice. But I think the easiest step, the least intimidating, is just asking a question. So just, having a wonder, having an inquiry, thinking out loud, why do we do it this way? Is there a better way? And sometimes it's that, is there a better way to do this for our patient? And so, um, starting with that mindset on day one, I think sets the stage for the involvement in some of those councils or some of those committees, or taking on more responsibility like a charge nurse or a mentor. That is really foundational to all of those other opportunities that come as a registered nurse.
Yeah, great advice. So, looking back at your career, what's the biggest lesson that you've learned about the power of EBP to transform care for patients and teams and for our profession as a whole?
Well, that's a great question. Yeah, it's definitely powerful. I think that evidence-based practice, when implemented well, directly improves outcomes. Whether that's fostering or improving better times for patients to receive that thrombolytic medication, or decreasing their length of stay. Um, I think it does that for the patient. For teams, it fosters like collaboration and communication at its highest level, which is imperative. For nursing, we have to be able to communicate. We have to be able to collaborate with all the professions that we work with. And then at the professional level, it really elevates nursing.
Mhm.
Nursing is the number one trusted profession. And why is that? Why do they trust us? And I think it goes back to because patients, families, the communities ensure their trust because they believe that we are evidenced in our practice. They believe that what we're doing for them is the best thing to do. And so if, that's the highest honor, right? Is the community and the patient saying, I trust you how do we ensure their trust, right? We need to
Mm-hmm.
be evidence in their practice. And that really just starts with, you know, believing in evidence-based practice, asking those questions, building a culture for it, all of those things
No,
are
that's
important.
great.
Yeah.
Yeah. I appreciate that. And I appreciate how you spoke to how it impacts, the patients and our teams and our profession as a whole, because it does across the board. And I think it's even to think about in my career, I've been a nurse for about 18 years. And to think about even in that amount of time, the establishment of evidence-based practice in a way where it is a very intentional process. It's done so much to improve the care that we provide to our patients and the outcomes. And so I think it's an exciting time to be able to not only um, have be connected to the evidence, but understand how it applies and how it informs our practice and makes us better every day. So those are great examples. We've had a
And now the integration of technology.
Oh yeah.
We got to think about that. Like it's exciting for these new
Mm-hmm.
nurses and all nurses. It's exciting because now how do we integrate evidence-based practice with AI,
Yeah.
with technology, um, because that really is the future. And I think it's a great time, but we need the nurses to be able to ask questions, to provide input and feedback on their workflows, their day to day. What, where is their opportunity? Like, where do they wish they had more time with their patient? And
Mm-hmm.
so being able to, share that insight with people, know who you can go to, and be a part of that change, I think is critical.
Yeah, absolutely. That's such a great point. And our new nurses are getting into nursing at a time where they're going to be experiencing uh, this implementation of AI and technology in a way that it's going to totally transform the way the nursing profession practices, I think.
Absolutely.
So I think we could spend a whole nother hour talking just about
No, for
that.
sure. Yeah.
But anyway, well, we've had a great conversation so far, and I really appreciate your insight. One of the things I always promise is that I will take some of what we're learning and show how it's going to show up on NCLEX style questions or our exams that we're going to have upcoming in the course. So if you don't mind,
My
if you
hands started to sweat right when you said NCLEX.
I know, it makes us nervous just thinking about it. But
Yeah,
do you mind answering a few practice questions with me?
sure.
Okay, so let me get these
Give it a
pulled
whirl.
up. Hopefully I think they'll be pretty easy here. So, all right. So what I'm going to do is begin by reading the question and the answer choices in case somebody is just listening and not watching this discussion. So I'll do that, and then I'll let you take a stab at figuring, letting us know what you think the answer is, and then we'll look into the rationale behind it. So to start us off with the first question, a nurse manager is reading a peer reviewed journal article about a study using a new pain management protocol for clients with terminal cancer. Which factor is most important for the nurse manager to consider when determining whether the protocol is appropriate to implement on the unit? Would it be A, do staff members support the implementation of the new protocol? B, do the characteristics of the sample population match those of the unit population? C, what are the credentials of the study's researchers? Or D, what type of financial support was provided for this study?
Hmm. This is interesting. I can see some value in a few of these, but I would say which factor is most important. So you always got to go back to the most
Mm-hmm.
when determining whether this protocol is appropriate to implement on their unit. If I was the manager, I would think the most important would be B. Do the characteristics of that sample match those of the unit? Because it may not be, you want to think about, can this be replicated
Mm-hmm.
in my unit with like patients, like units? And so I think the best answer would be B.
Okay, great job. You are correct. So now you can breathe just a little
Yeah.
bit.
All right. Good. One down. And
Yeah.
no, I
So
did not see these questions.
yes, no, I know. That's the cruel side to this is I don't ever show it to you guys
Yeah.
my questions. So when evaluating research for practice change, we have to determine if there's a reasonable similarity between the unit population and the study population, just like you said. And it's an important consideration that needs to be one of the number one things that we think about. So let's say, for example, if we had a pediatric clients with acute pain, the protocol for adults with terminal cancer might not be appropriate for a pediatric population. So that's a real kind of a obvious example, but all the way down to the to the details of the similarities is very important. And so if we think about the other options, just to understand why they're not the most important, it is going to be necessary to evaluate the level of support from staff members, but before implementing the protocol. But that at this step, when we're looking at the articles and assessing interventions, we're not at that step yet to be considering that. Also, let's see here. The educational credentials of the researchers might be relevant as far as, understanding their perspective. But the integrity of the research process and their findings are going to be more important than credentials. And then financial support that's needed at some point, once again, that's going to need to be considered once we identify that this intervention is appropriate to this population. But at this point, it's not necessarily the most important thing we need for determining if that protocol is appropriate for the unit. So, all right, great job.
Great explanations.
Okay, so moving on to number 2. So, this question, a community health nurse is planning a program to educate parents and caregivers in the community about childhood immunizations. When incorporating evidence-based practice, the nurse should identify that which of the following is a focus of implementing the program. Is it A, the model of evidence-based practice preferred by the provider? B, the implementation of interventions that focus on the health of individuals? C, the values and preferences of the community? Or D, the use of one research article as an example to focus the objectives of the program?
I'm automatically ruling out D.
Okay.
We never really use one research article.
Mm-hmm.
When I think about incorporating evidence-based practice, and I talked about this, we must consider the external evidence, the clinician's expertise, and the patient's preferences and values. So my first instinct on this would be C.
Okay, great job. That's also correct. Oops, I forgot to make it red, but it's bolded. So the values and preferences of the community, absolutely. And I appreciate you taking us back to those 3 pillars that are really important. If we're going to implement something that the community or the stakeholder, the end user does not value or prefer, then the implementation, it's we're going to come up against major roadblocks, or who knows, we could even cause more problems if that's the case.
Right.
Right. So, to go over the other answer choices and understand why they're incorrect. So, the model of evidence-based practice preferred by the provider, we should recognize that guiding care in the community and the evidence-based process that supports that is more more of a focus than what's preferred by the provider. Ultimately, we need to collaborate with the provider to make sure that we utilize their expertise, but that's not necessarily the driving factor. With B, the implementation of interventions that focus on the health of individuals, we do want to think about the individuals, but once again, the process and the values and the preferences of the community, it helps to inform what those preferences would be that help us to focus on the health of individuals. But it's, going back to those 3 pillars, that's really what we're looking at. And as you said, with the use of one research article is never going to be the case. We need to make sure that we're using a body of evidence that collectively supports a decision or an approach or an intervention or whatever it might be. So, okay, last one. All right, an occupational health nurse is having difficulty implementing evidence based interventions in a workplace safety program provided by their company. Which of the following statements should the nurse identify as organizational barriers to implementation of evidence-based practice? In this case, we get our favorite select all that apply.
Oh, terrible.
I know we couldn't escape without one of these.
Select all that apply. Do they have these on NCLEX now?
They do. In
Okay,
fact, they
awesome.
have two different forms. Sometimes it's select all that apply, and you have to guess how many. Sometimes
Oh,
they have select N, is what we call it, and they're told,
how
select
many?
5 correct responses. And it
Okay.
can have anywhere from 1 to 10 options. So, yes, they're still
Okay.
there.
Awesome.
So, all right. So, for our answer choices, so these are which of the following statements should the nurse identify as organizational barriers to implementation of evidence based practice? So, A, the nurse does not know how to conduct advanced searches on evidence based databases. B, the nurse has limited information technology skills. C, the nurse does not have experience in evaluating statistics. D, the nurse has limited time related to heavy workload. And E, the nurse was told by a supervisor that management does not support changes in practice.
Okay, so it wants to know, and this is kind of what's throwing me off here. Which of the following statements should the nurse identify as organizational barriers?
Right.
I'm thinking organizational barriers.
Correct.
Each of these answers starts with the nurse.
So somewhere in you're on the right track focusing on the organizational barriers. So what the question is kind of driving us towards is recognizing there's a difference between personal barriers and organizational barriers.
Mm-hmm.
So all of these might be things that the nurse themselves is experiencing,
Yeah.
but maybe look at the answer choices from a standpoint of which of these are because of the organization and which of these might be from some other factor.
Yeah. So organizationally, removing the nurse, which is throwing me off here. Organizationally, I would say D is an
Mm-hmm.
organizational barrier, their workload. And I would say E for sure if management is not supporting it. Those are two organizational barriers. A, B, and C are nurse limiters or barriers. Um, but hopefully the organization has resources for these things. I'm gonna go with D and E.
Okay. The correct answers
Or
are
all the above. Oh,
no,
C, D,
you're
and E.
you're on the right
Okay.
track. C, D, and E. Let's look at the rationale because I'm kind of tracking with you where very obviously I can see time in a heavy workload would limit your time and availability. Being told by a supervisor that management doesn't support changes in practice, well, I hope that's never happening, but that would be an
Yeah.
organizational issue. And so let's understand why C would be. And from my rationale, the nurse identifies that the absence of encouragement for evidence based practice process is a common organizational barrier to implementation of evidence based practice. Um, that's not, I think I have these maybe out of order here. Let's see here. The nurse identifies that insufficient understanding of how to search for evidence is a common barrier related to knowledge deficits. I think I would actually argue that C is maybe not so much a correct answer here on this one. I would go like you with D and E,
Yeah.
because really the first three have to do with the nurse's own
Knowledge
per
and skill.
right,
Yeah.
exactly. So the nurse does not know how to conduct advanced searches on evidence-based databases. There's an opportunity for personal growth and development there. Limited information technology skills, same thing, and experience in evaluating statistics. That is something that can come from personal and professional development to be more effective in EBP. But the D and E, where the nurse has limited time related to their workload and was told by a supervisor that management does not support changes, those are more organizational barriers. Really, the objective with this question is around being able to recognize the difference between the two, that sometimes we face barriers from our own self and sometimes
Yeah.
they're more from the organization. How can we collaborate to make those more effective? Or from a leadership standpoint, how can we support the professional development and the advancement of evidence-based practice in our organization. So that was a trick question.
That was good though.
Awesome. Okay. Well, that is all the questions that I have for you. Thank you for working through those with us. And I think there were some good learning opportunities. So I have one last question that I like to ask all my guests, and that is, and it can be related to our conversation or otherwise, but what is the best advice you've ever been given?
Hmm. I have a couple.
Okay.
One was keep on smiling.
Mm-hmm.
But in all honesty, I think it's never stop learning.
Uh-huh.
And I was given my mom gave me that advice. She was an educator her entire career, and she we really grew up in a home that supported education. And so I think beyond the degree, right? I mean, you think about I went and got my bachelor's degree, I got my master's degree, got my doctorate degree. Beyond the degree, learning in some capacity is so important. And I think as nurses, it is our obligation to never stop learning because
Mm-hmm.
healthcare is constantly changing, evolving. So, arming ourselves with as much knowledge, whether that's through just reading or joining organizations, doesn't have to look like going back to school. That's not for everybody. But whatever that form of learning looks like, I think always, think about that. The moment we stop learning, we stop improving,
Mm-hmm.
care for our patients. So stay curious, seek new knowledge, reflect on your practice, and then continue to grow as a professional. So that would be my best advice. Never stop learning.
That's great. And I appreciate that advice. It aligns very well with what you have shared with us because we can't be engaging in evidence-based practice if we're not learning and exposing
Right.
ourselves to new information. But it's so foundational. And I do always encourage at the end of my podcast, that's one of the things I always say is to stay curious because,
Yeah.
man, I don't know. I'd be really boring if I wasn't curious. And I'm always discovering and learning new things that I'd never imagined I would know. So excellent advice. Well,
Thank you.
thank you for joining me today. Your expertise and examples really helped to show how evidence-based practice comes alive in the clinical setting beyond what we just read about in the textbook, which can feel a little distant and less applicable. So, for our listeners, I hope this episode helped you to see that evidence-based practice isn't just about reading research. It's really about asking questions, seeking out the best evidence, and translating that into the care that truly improves outcomes for patients and for our teams as well. So remember that applying evidence-based practice means staying curious, valuing the preferences of your patients, collaborating with your colleagues, and being open to change. These skills will not only help you succeed on your exams, which you need to know this information for, but really in a practical sense, they'll help define you and the kind of nurse and leader that you want to be and grow into. So thanks for tuning into Nursing Leadership Chats with Dr. Wise. And until next time, keep learning, keep leading, and stay curious. Thank you.
Thank you so much.